Good morning. What is your name?
Good morning. I'm Leahy, Administrator for Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Program.
Okay, and since the county is basically closing the doors to the public, and part of our charge is to serve the people and serve families, and mental health is a big part of isolation when we are told to use social distancing. And like we're not supposed to, interact with our grandchildren if we're older. Can you tell me how you're going to be servicing our residents during this time of really it's a worldwide pandemic?
Sure. Well, we are all working. We continue to be in the office. We will continue to mostly call folks via the telephone. So a lot of our services will be through the phone. However, there are some services that will continue to be delivered that would be face-to-face. Some of those services might include our injection clinic. So for those that have injection, those would continue to happen every Tuesday afternoon. We will be calling individuals, and if there are emergencies or things that they need assistance with, we will be doing face-to-face. We will be taking necessary precautions. So when we go to the home, we will be asking questions of the folks, and if they're exhibiting any of those symptoms of COVID-19, then we will take the necessary steps to assist the individual. It might look a little differently, but we will definitely be, working out of the office in the community and continuing to assist our folks with serious mental illness, intellectual disabilities, and early intervention needs.
Well, I have to tell you, I think of the Good Samaritan, and you and your staff are to be commended for continuing to serve the clients in need. Some of these are our most vulnerable citizens. And with the governor yesterday closing down so many businesses, is there a concern that someone won't be able to get their medications, which are needed to make sure that mental health is stable?
No, there should be no concerns with regard to medications, any psychiatric medication needs that they may have. Our doctor will continue to be in our office on Tuesdays and Thursdays. Most of the time, the doctor will be calling individuals, and then she will be prescribing either writing a script that the individual can pick up, or she will be calling that into the pharmacy if at all possible. So we will continue our medication and scripts for individuals. That will not be discontinued. If individuals are having increased symptoms and really feel that it's an emergency and they must talk to the doctor, she will be talking to individuals over the phone, making assessments and determining how she can best help, whether that might be decreasing a dosage or increasing a dosage, or maybe that is that they need additional support through crisis intervention assessment to determine if it's a higher level of care that is needed. So all of that will be done and completed. So there should be no concerns with regard to ongoing services and supports. They will continue.
So for the most part, unless one of our workers would unfortunately become ill, they will have the same caseworker and everything should feel comfortable throughout this, right?
Absolutely.
Okay.
Yes. And even if the case manager is unable, the supervisor is typically known to our folks that receive services as well. So most likely it would also be the supervisor that perhaps would be contacting them.
Okay. And so do you have any other information that you want to share, or phone numbers or emails or anything of that nature?
I just want to ensure that everyone knows our number here, our office at Lebanon County Mental Health, Intellectual Disabilities, Early Intervention is 717-274-3415. Also, if folks are in crisis and they need emergency services and need to be assessed immediately, please call Crisis Intervention and Information Services immediately. That number is 717-274-3363. So please don't hesitate to call. Our crisis intervention is there 24/7 and they are continuing to deliver services. So please call if you need anything. I do also want to tell you that many of our services and supports in the community, their status is changing on an ongoing basis. It's changing rapidly. So if you have any questions or if you can't reach someone and you really would like to know some information, please feel free to call our office. We'd be happy to answer any questions that you may have with regard to our services as well as what's happening in the community with regard to services and supports.
Okay, and in closing, did you have anything that you wanted to say about Lebanon County Christian Ministries or any of the services that might be related?
Sure. Well, we did receive some updates from Lebanon County Christian Ministries. They are telling us that their free noon meal site will be happening until further notice. Now, there will be no sit-down lunch provided, but a lunch will be served as a grab-and-go style and will be done outside. If you have individuals that use the noon meal site, please make sure they know not to go to the location listed on the weekly schedule. Then also with regard to Lebanon County Christian Ministries, they also provide the Fresh Start Shelter, and that's important as well. They are continuing to do face-to-face assessments. If there are any questions about the health of a potential guest, they will send that individual to the hospital for assessment. And as of yesterday, they were still accepting new guests at the shelter. And if churches close, then guests will shelter literally at Lebanon County Christian Ministries. Anyone needing food bank, clothing bank, heating oil, utilities, anything like that, please feel free to call Lebanon County Christian Ministries, and a phone interview will be conducted and arrangements made for the pickup of those items needed or forms or anything that they can assist you with. So that is an update from Lebanon County Christian Ministries as of yesterday.
Thank you so much. Your calming voice, I'm sure, will resonate with all the people out there in the community. Is there any closing remark or something I forgot to ask you that you wanted to share?
I just want to assure everyone that we continue to deliver services and work in the very best interest of the individuals we serve. We feel that you are of the utmost importance. We are taking every precaution that we can to ensure the safety of the folks that we serve as well as our staff. And so we are here for you at any time. Please do not hesitate to call us.
God bless you and all of the staff here at MHIDEI. Thank you.
Thank you.